It is a staggering amount of time that they're going to need to catch up with this backlog. There's no doubt that COVID-19 has had an impact on a variety of services, but there is no blame here being placed on the NHS because everyone knows what an extraordinary year they've had. They've been very good at catching up with urgent care procedures, but it's others that are lagging behind. If we take you through some of them that the NHS providers have picked up on, the first one is cancer care, not necessarily referrals, but those waiting to start treatment. The other one is elective surgery, hip and knee replacements, spinal surgery, nose procedures too. There are also concerns about other areas, less visible backlogs in mental health and community services. Now, NHS providers have heard from a number of trusts about this that say it's going to take them about 3 to 5 years to catch up with those services. And we reported on Friday, if you remember, that some 4.7 million people in England, as of the end of February, are waiting for their hospital treatments to start. I spoke to one of them on Friday that she was one of 387,000 people who'd been waiting over a year for a routine procedure. Here is NHS Providers Chief Executive Chris Hobson talking to us this morning.
Particularly in the early 2000s, we had a similar problem. And the way we tackled it then was effectively we did lots of overtime. We used the private sector. We had a kind of ruthless focus on cutting waiting lists. And the reality, I'm afraid, is that, A, we've got many more priorities now. We absolutely have to deliver the long-term plan, NHS long-term plan. We've got to work out how we live long-term with COVID. So we haven't just got a small number of priorities. We've got a much larger number of priorities. And the real issue is that actually we're going to have to do things differently. If we just try and do it the same way we did it back in the early 2000s, we're not going to get through this quick enough.
There's a number of solutions the organisation have told us about. The first one revolves around capacity, building up the NHS workforce to expand how many people are in the NHS itself. We know they are overstretched as it is. The other one is restructuring hospitals so they're better prepared to deal with further COVID waves and annual winter struggles, particularly because we know winter is a very difficult time for them. The other one is improving efficiency with trusts working better together. Now, NHS England have had to cope with over 400,000 COVID-19 patients throughout the past year. As I mentioned at the top, they have had an extraordinarily traumatic year, but the Department of Health has commented on this today. They have told us we are backing our NHS, they say, with an extra £7 billion for health and care services this year, bringing our total additional COVID-19 investment to £92 billion. This includes, they say, £1 billion to support NHS recovery by tackling waiting lists and providing up to 1 million extra checks, scans and additional operations. Recognising there the significant challenge they have ahead, but it looks as though the government is putting in the funding they need.